Acupuncture may help ease issues like anxiety, sleep issues, sports injuries, and even backpack-related aches and pains. So joining us this morning from VUIM Clinic is Dr. Haley Parker. Dr. Parker, good to have you.
Thanks for having us again.
Of course. So tell me all about this offering that you all have for kids and for teachers alike, free treatments.
Yes, well. Absolutely. So we want to say thank you to the future of our America and everyone who is helping out in building our future young practitioners. We have a back-to-school special for all school-related faculty and staff. So whether you're back office, custodial, affiliated with bus driving, or teaching the students, please come in. You just need to bring your teacher ID or some school ID, and we'll be able to apply the discount. It will be a complimentary treatment in our team care clinic or 50% off in our private clinic.
Very cool. Now, for those who are not familiar with acupuncture, or some who are, maybe fear it. Talk about it. What is it exactly and the benefits?
So that is a great question. So it's a very traditional medicine over thousands of years old, and it helps to stimulate the brain and body connecting in with itself and helping to reset the body's systems to help heal from the inside out. So we take these little tiny pins, they're 1/6 the size of a hypodermic needle, and when placed along points across the body, it helps to create a relaxing effect where the patient has to lay there. The hardest part is to relax and be able to just deep breathe, focusing in on their brain and body, and ultimately we focus in the treatment on whatever the main concern is. So for our pediatric patients, a lot of the times it's sports-related injuries from soccer season, the backpack injuries like we were talking about, carrying their books and maybe their sports change clothes for later on the practice day.
Yeah.
Or whether it's maybe an injury from the mental side of things, from going back to school, their circadian rhythms and the stress that comes with a change of schedule.
How long are the sessions?
About 30 minutes to 45 minutes, depending on a person's tolerance.
Okay.
A new patient appointment will always take in a medical intake, so that might take a little bit longer, so just plan ahead for a little longer the first treatment.
All right, let's move over here to your pediatric patient. Maddox, right? All right, so talk us through what this process would look like if you were to do this with a child.
Great. So this is Maddox, and Maddox is a frequent flyer. So Maddox is used to the acupuncture needles. So the acupuncture needles, like I said, hey, Maddox, I'm going to put one right here on a great point for the upper back and neck. The acupuncture point is right there on the hand for Maddox. And what we do is we have this little piece of plastic called a guide tube. And that guide tube is very unthreatening. And then with that, we put the guide tube on the skin and we tap the needle in. And really, you don't feel it. Maddox,
I was going to say, did you feel it?
No, I didn't feel it. So with that, if a child or a young adult is really nervous about needles, because sometimes that is a legitimate fear, we have something called a piezo pin. And a piezo pin just puts a little electrical current through the body, and it helps to stimulate those acupuncture channels. It's often a great segue into treatments, and as the patient is a little bit more comfortable and the parent is a little bit more comfortable with the process, then we're ultimately able to get a better treatment for the patient. We take the needle out, and he's good to go.
Okay, how young are the pediatric patients?
We have patients who
are age range.
I have seen patients as young as 2 years old, all the way till about 18. As far as like the 2-year-olds, we definitely use different modalities based on the patient's tolerance, and that's very individualized. As far as the parent is also in the room with the patient, so between the parents, the pediatric patient, the practitioner, we have a great toolbox to help address whatever concerns are going on.
All right, and like you say, this is just excellent when it comes to just relieving stress or just any anxiety.
And we know that these days there's a lot of things going on for our young adults, and so if we can help with the brain, the body, and then those developmental issues, we can ultimately create a much better, healthier, harmonious school year ahead. And this summer we have a Pokemon special, so any pediatric patient that comes in for your first treatment, you get 2 Pokemon packets, and then from there, any follow-up visit, you get 1 Pokemon packet. We also have different herbs. We've disguised them in a really nice strawberry flavor herbal formula, but growth and development jelly. So in addition to any sports-related injuries, we can help with the repair and the mending from the inside out, along with brain development and helping to support the young adults' exponential growth.
When it comes to preparation, anything needed before a session like this, or what should people do, if anything?
Well, I tell them to take a look at our website, vuamclinic.com, so they can answer a lot of your basic questions. But ultimately, come in. The first treatment is a lot of rapport, getting to know you, consultation, but always come in and have fun, right, Maddox? Yeah, and really health is fun, and we focus on wellness.
All right, and obviously you have great people at the helm to guide you through this. So thank you so much. Of course. And then tell us one more time, VUIM, the website?
vuamclinic.com. You can also check out vuim.edu if you're at all interested in becoming a student or pursuing your career, advancing your medical education.
Awesome. All right, thank you so much, Dr. Parker. All right, Steve, sending things over to you.
We can't thank you so very much.